We interrupt this program for an exclusive story from News 21. Here's our on-site reporter, Bonnie Lynn.
Hi, this is Bonnie from News 21. I'm right outside the home of Mr. and Mrs. Hemoglobin, where a brutal attack by a said vampire has just occurred. Fortunately, the couple has a surveillance camera in their home and the whole heinous event was caught on videotape. Watch this. It appears that the said vampire is giving Coumadin to his victims, which is a known anticoagulant, in order to thin the blood of his victims before he bites them. Here is our physician expert who will discuss Coumadin and why a vampire would use it before he attacks his victims.
Hello, I'm Dr. Hilke, and I'm here to talk about Coumadin, also known as warfarin, which is a known anticoagulant, and why a vampire would possibly use this before attacking his victims. Coumadin helps prevent the clotting of your veins and your arteries, and it also helps to prevent myocardial infarction, which is known as the common heart attack. This helps to reduce the risk of death. Coumadin's method of action is it interferes with vitamin K, which is a known coagulant. The pharmacokinetics of Coumadin is that it's well absorbed in your GI tract after oral administration, although it can also be given intravenously, and it crosses the placenta in pregnant women but does not enter the breast milk. And 99% of it is protein binding. As well, it's metabolized by the liver and it has a half-life of 42 hours. If the vampire's victims survived, the side effects normally experienced with Coumadin would be cramps, nausea, dermal necrosis, and fever. And adverse effects, of course, are bleeding. And perhaps this is why the vampires are giving the Coumadin to their victims before they bite them, in order to thin out the blood, in order for it to come out much quicker and easier. The therapeutic effects of Coumadin is prevention of blood clotting events. And of course, the antidote is vitamin K.
Any information on these vampires, please call 1-800-VAMPIRES.
This has been a News 21 exclusive. We will now return you to your regularly scheduled program.